PADnet tip, History and Indications. Part 1, Patient tab. The first thing you'll see when creating a new test on the PADnet software is the Patient tab. You must fill out each form field with the red icon. It is important to fully complete the required form fields, for the interpreting vascular specialist needs this information in order to properly bill the patient's insurance. Part 2, Insurance tab. The next tab that must be filled out is the Insurance tab. Just like the Patient tab, everything with the red icon must be completely filled out. Part 3, History tab. After you've filled out the patient and insurance information, you must fill out the History tab. Notice that there are subtabs to complete. The first tab beneath History is the Risk Factor subtab. You must complete the drop-downs to the best of your ability, and you must also include the patient's weight and height. This information will be very useful to the reading physician when they interpret the studies. There is also a Notes subsection beneath the History tab, and here you can add information for your reader that is instrumental in the interpretation. An example would be if the patient has had a mastectomy on their left side. You would include this information to explain why you were unable to get an ABI for the left side of the body. Notice that all information in the top section can be seen only by the reading physician. The bottom section can be seen in the printouts of the study. Please keep sensitive information to the top blank box, such as obesity in the patient. Part 4, Indications tab. Finally, primary indications can be entered in the Indications tab. First, input the referring physician. Once you've entered it, you'll be able to pull the doctor's name from the drop-down menu. However, the first time you enter a doctor's name, you will have to click on the new link on the right-hand side and type it in. Below, you can choose the reason the patient is having the study performed. The most common reasons are claudication, rest pain, or extremity ulceration, but there are additional options that can also be selected. Once you make your selection or selections, you'll be prompted to enter the side of the body that this is occurring on. Just like the History tab, there's an additional place for notes or other information you want to be included for the reading doctor's benefit. If none, just press the space bar once to clear the red icon. After you've entered the indications, click Select down below and the system will pull up a list of ICD-10 codes based on what indications you've selected above.